Our next session is going to be looking at determinants of health and asking the question, are we determined enough? And that feels a little bit like that scene from Dirty Harry, where you've got Clint Eastwood with a gun and says, so do you feel lucky, punk? We are putting ourselves under the microscope. Are we determined enough? And I'm going to leave you in excellent hands. I'm passing over the reins, the moderator baton for this session to Monika Kaczynska, with whom I've had the pleasure of working for many years, former Secretary General of IFRA, and of course, now at the WHO. Monika.
Thank you so much, Tamsin. Thank you, everybody. And before I start properly, I want to say a big thanks to Milka and the IFRA team for such an excellent conference today and the opportunity to be here. Now, just as you are all relaxing into your post-lunch slump, for some reason, and I'm sure it is not a coincidence, I always get the after-lunch slot, which means that everyone's a little bit sleepy. So I need everybody to stand up, please, on your feet. We're going to shake it out just for one moment. Those, lift your arms up, wake up a little. We've got a fantastic panel for the next 40 minutes. And when you're ready, we can sit down again. Okay. So are we determined enough? I'm not sure. Let's see. So this is a fantastic session, and it's a real privilege for me to be back with so many friends, so many colleagues in the audience, and also on the panel. And I was just reminiscing with Sir Michael that 10 years ago, I was moderating him as IFA SecGen just down the road when he was presenting the WHO Commission report here in Brussels for the first time. 20 years ago, I was booking his tickets for a WHO meeting as a flight. So it's a privilege to have Sir Michael Marmot on the panel with us today. And also we have Charlotte Maschon-Dies, who is the former Health Mayor, Deputy Mayor of Rennes, and President of the WHO European Healthy City Network, who I've also had the great privilege of working with for almost a decade now. And last but not least, our own Florence Bertoletti, who many of you will know, formerly from the Smoke-Free Partnership, and now with Eurocare and IFA Vice President on more than one occasion, I'm sure. So I'm standing up because I'm not very energetic when I sit down, so forgive me. But we've been asked this afternoon to talk about the changing landscape of determinants of health and whether we are determined enough to meet the challenges that they bring. So we've known for a very long time, and not only the fantastic work that Sir Michael and his team did 15 years ago, but 40 years we've known the importance of social determinants of health, of working across different sectors, of the role of economics and other important issues, and increasingly, of course, commercial determinants and political determinants of health. And we also know that we actually know what we have to do. The evidence is quite clear, and it has been for quite some time. So one of the questions that we're asking the panel today is, have we done enough, and why not, if not? And one very important element, which all of you are familiar with, is the role that social movements and civil society plays in that push for change, when we know that something different has to happen, and sometimes pursuing change is quite uncomfortable for those that are pushing and those that are receiving the push. Because what fundamentally we're talking about in this conversation is power structures, and changing power is not an easy and comfortable thing to do. And confronting power when that needs to happen is particularly difficult. So in that context, how, and this is my question to all, but we will be discussing this further, how can that collaborative and co-creative partnership-based approach that we all naturally come into this room with, this is what we want to do, it's why we're here. We believe in the same outcome. We believe that health equity matters and that we all have a role to do something about it. But how do we move towards confronting power and challenging power structures that do not deliver for us when our starting point is one of collaboration and co-creation? And is that even possible? So, not a very easy set of questions, but you have an absolutely phenomenal panel for which to address it. So Michael, if I can start with you. You're not only one of our leading academic lights in the public health movements, working on health equities for your whole career, but also one of our strongest advocates. And what do you see that we have done well since your seminal report in 2008? And have we seen the changes that you think we need?
The glass is always half full and half empty. When we published the report of the WHO Commission on Social Determinants of Health, one of the many stops I made was in Brussels. And I talked to professional cynics from the European Commission. And one of these professional cynics said, "Why did we need your report? We had Alma-Ata 30 years ago. Why did we need your report?" It's a bit confronting. And thinking on my feet, I said, firstly, even had we said nothing new, it needed to be said again. Every 30 years is not too often. Second, think about what happened after Alma-Ata. People interpreted Alma-Ata as being about primary care. Monique Bergin, who died recently, the former Minister of Health from Canada, she said, when we saw the Alma-Ata Declaration in Canada, we said, got nothing to do with us. We've got tertiary care hospitals. We don't need primary care. And the fact that social determinants of health was somewhere in the Alma-Ata Declaration, nobody noticed. And the world went galloping off in a different direction. Neoliberalism, market fundamentalism. So when you ask, why do we need a new report? Look what happened to the Alma-Ata report. And third, that was 30 years ago. There's a great deal new evidence that has accumulated. And we've looked at it. You look at the rise of publications on social determinants of health. It is astonishing. Open the Journal of the American Medical Association. The United States, the American Medical Association, when I was invited to go and talk to them, I said, if anybody had told me that I would be invited to talk to the American Medical Association, the most right-wing bunch of self-interested doctors, only interested in paying conditions, and you want me to talk to you about social determinants of health? Yeah, we do. And you read the JAMA. Now, they don't necessarily quite understand what social determinants of health are, but the fact is, I mean, a friend from the US told me that in one of the red southern states, when a politician was explaining why they refused the federal supplement to Medicare, he said, because social determinants of health are more important. As my friend said, the devil has the best tunes. So the fact is, it's in the language, even if it's being misused. And I'm a modest chap, but let me boast. I was sitting in Darwin at the top end of Australia, and I was had lunch with two Aboriginal men who were involved in community-controlled healthcare organizations. And they said to me, we use your report all the time. And I thought, when we began the commission, if I could have thought what the benchmark of success was, it never would have occurred to me, sitting with two Aboriginal men at the top end of Australia, hearing that they use my report all the time. So the good news is that we're on the agenda. You heard this morning. I used to go around the world saying I was an evidence-based optimist. And a Brazilian colleague in thickly Portuguese accented English said, Michael, you're using the English language incorrectly. Okay. He said, you're not an optimist, you're hopeful. Ah, he said, an optimist believes things will get better. You don't necessarily have a belief that things will get better, but you're hopeful. And it's a very important distinction, because if we think things will get better, we may as well go and play music or watch football or do other things, and things are going to get better. We don't need to do anything. But hopeful means with collective action, we can change things. So just to take, and I'll stop, to take one country, random country, the one I happen to live in, the United Kingdom. The central government, I was having coffee with a former minister from Conservative government in Britain. He said, you know, the present government doesn't like you. And I said, well, I kind of knew that, but to hear it put quite so boldly is a bit confronting. Many people have asked me, you know, how did the government respond to your findings and recommendations? Well, they don't want to talk to me. But we now have 40 communities across the United Kingdom that have declared themselves marmot cities or communities or regions. So the central government might not be listening. I have my inbox this morning from the government of Wales that I'm involved in various things in Wales and Scotland, all around the United Kingdom, in England. So we need to find the right places. My own approach, and we were talking about this as Joan Banach, my friend, came to London a few years after we published the commission report. I think he was a bit shy to say it to me earlier. When I said we wanted to launch a social movement, and Joan said, Michael, there's experience with social movements. People kind of know how to do that, and I don't think you've really done it. But I think our social movement is alive and well.
Fantastic. Thank you so much, Sir Michael. And I think it is an incredibly important message for us to remember just how transformative that was. I remember 15 years ago not being able to use the word equity in the EU policy space, and the report created the political window, the political capital for us to be able to start to use that in this context. And I took away 4 points from what you said to us, that it is on the agenda, and collective action and repetition was a big part of bringing it back onto the agenda, putting it higher on the agenda, and retaining a sense of hopefulness for change is critical for us as we start to think about our determination in what we do. And picking up on your point about marmot cities, because I think that's quite one of the important dimensions, which is not often enough, particularly in perhaps this space, is the local level. And so Charlotte, turning to you, you're not only an experienced global public health advocate, but also critically at the political and the local level. What would you see the main points that we can learn from public health work over the last 15 and 30 years? And would you agree with Michael's sentiments around hopefulness, collective action, and repetition as being crucial?
Thank you very much. Well, I wouldn't dare not to agree with Sir Michael Marmot, especially since I still somehow feel like a newbie. I come from activism. I was active in sexual and reproductive health when I was in high school. But then one thing leading to another, I got elected and I got chair of WHO Healthy City Network. And then I was involved in global health. And in France, I changed laws and I ran a presidential campaign on health. And I don't know how these things happen. And what I think is, first, I'm maybe hopeful, not optimistic at all, but I'm determined. And I'm really determined to make a change and do what I can to make a change for me and my kids and your kids and all the future generation. And for what I learned, it comes with lots of coffee, what works with tea, of course. If you see what we did in healthy cities, sometime my legacy could be from what I did in my city was, for instance, involving mental health community in the policymaking from the beginning. And what we did is a charter on how to engage them better in the policymaking. So I went and have coffee with them and to ask them, what would you need? Well, first we need not to be having meeting at 9 o'clock in the morning because we're taking medicines that make us sleep a lot. So it's really hard. And we need a break every hour because we have those medicine and we cannot focus this time. And this is one of the things people are like more proud of what I did. I just took coffee and listened to them. And then for WHO Healthy City Network, I became president a little bit by luck because my city has a long legacy. And we took a lot of coffee with other city mayors and asking, what do we need? And they said, well, the national laws are not working for us. They're asking us to do more health without giving us needs and means and funding to do health and non-competencies. So I said, okay, let's go to the minister and say something. And we said something together. We gathered, we empowered ourselves, and we delivered. And actually, we changed laws, not the big one, but we changed laws. But just because we were some kind of naive and getting together, and we didn't have strategy or very something like based on evidence or anything, we just went there. We say, we have all the evidence, we see the researcher and everything, but then we need to talk to people and they change things. And that's what happened also with WHO Healthy City Network in Europe. We met and we talked and like, where are the politicians, Monica? And they say, yeah, right. But health is political. So how do we involve more politicians? So you created at WHO European Network a political vision board. And we're so happy. We're so happy because we're meeting in person and we're wondering how we can have our advocacy at a bigger level. And this coffee thing is not only true for policymaking at this kind of level, it's true also to create long-lasting policies. And if you ever heard the Health in All policy advocate Carmel Williams from South Australia, she said, I was paid 6 months to drink coffee. And I went to every office. She loves coffee. To every office, urban planner, economy, agriculture. And she sat there and learned to meet them and see what were their interests. How much did they know about health? Do they know the Marmot report? No, they don't. I'm sorry, they don't. All those people we have to work with, all those people who have the fundings, who have the lever to act upon economy, upon housing, upon migrant policy. They don't know about health. They don't know about equity. They really think like people being obese is a lack of will, they're not moving enough. They really think that depression, oh, come on, got to move a little bit. So we need to go and engage with them more, but not with lots of reports. I mean, we need to read the reports, obviously, but we need to translate them into much better evidence that we can share in an elevator with an elevator pitch that you can, in 2 minutes, tell the mayor of London that he needs to act upon air pollution. And that's what he did. So probably someone did a very good advocacy there. So I think we need to sit more down and listen to people. And that's how we change policies.
Thank you very much. That's excellent. So I heard, a couple of things there. Your point around the so meeting the community where you find it. So going to the community and not expecting them to come to where we are or where policymakers are, to ask what is needed. So take a needs-based approach to public health change, to you build connections and turn them into relationships with coffee or tea or whatever one's tipple is. no, of course, beverage of choice and a non-alcoholic beverage of choice, and finally get our asks in order. But Florence, I'm going to turn to you now. So what if that isn't possible or desirable? Let's, more than most perhaps, that the commercial actors can play a very detrimental role in public health, undermining not only public policy, but also public health actors themselves, as we have seen very much up together. So my question to you, what do you see are the main lessons that we can learn to move forward, both successes and failures in tackling the commercial determinants of health, where some of our more cooperative approaches are not only ineffective, but also inappropriate?
I'm not going to start with the commercial determinants of health. I'm going to start with tobacco. because I'd like to put things into perspective. So if I ask the audience right now, how many of you remember smoking in airplanes? Please raise your hands. So all the young people don't remember that, but we grew up in a world where people were smoking everywhere, including in aeroplanes. Now, another question. How many of you remember or know what is the date where the first country went smoke-free in the world? How many years was that? Some people in the room know. What was the year and how long was it? Raise your hand, those who do know.
Anyone going to throw some numbers out? I'll repeat
First
it for the
country
people
in the
online.
world went smoke-free.
Go on, hazard a guess. Martin, I'm picking on you. And which year?
It was Ireland.
Which year? 2010, 2011. Those are our guesses from the
No,
audience.
it was 17 years ago. 17 years ago, so it was in 2006. No country, zero in the world, was smoke-free. Okay. Now, another third question, and then I'll start to respond about the successes. How did that happen, and the failure of the tobacco control movement? The third question is, now, if you go everywhere in Europe, you see these massively big pictures on cigarette packs. And in some countries, you see plain packaging. When we started the Tobacco Products Directive fight, how many countries in Europe had a picture?
I know the answer to this one. Does anyone know?
Well, there were only 6 countries in the entire, well, not in the entire WHO region, but there were only 6 countries in the EU and very few outside. Now they're everywhere. So change is possible, okay? It's possible. So how did we manage to do that? I would say there were 3 key things. The first one, talking about sitting on the shoulders of giants, it would not have been possible without few very clever, important individuals, and he's right there. I mean, the tobacco control movement was developed by individuals at the international level and at European level. It needs to be said, if Archie Turnbull had not created the tobacco control movement in Europe, it would not have happened. And what he understood and taught to us, I mean, there are many of us. There's Fiona, there's Anka, there's Lilia, there's Muriel, there's you. I mean, there's Monica, and there's many of us. But it was it was a war. It's the importance of meeting them where the industry is. It's not about education. It's not about raising awareness. It's about lobbying, and it's a war. Okay? So let's be clear. So first thing is understanding the policy process and the importance of the legislative impact. Number 2, I think it was understanding that they are not part of the solution. Going back to the commercial determinants of health, no industry, none. They are all health harming. The weapon industry, the oil industry, the car industry, the alcohol industry, the food industry, the pharmaceutical industry, they are not part of the solution. They are the problem, because health is not created. Health is the absence of disease and the state of mental and physical well-being, WHO quote. And so they are not part of the solution, and we keep involving them in our discussions. And because we have this lack of funding, you know, we sometimes have to ask them for help, the pharmaceutical industry. They're not part of the solution. And the third thing is the importance of a strong voice and united voice. Now, the failures of the tobacco movement, I believe, is that it's precisely this, is that the tobacco control movement in its fight, sort of went into tobacco exceptionalism, as if the tobacco industry is different from the others. And I won't go much further, but I do not believe that okay, what's the point of creating a smoke-free generation if that generation is drinking itself to death, doesn't have decent housing, and is at war or can't breathe clean air, and is frightened because they don't have any perspective to live a decent life. So that's it.
Thank you very much, Florence. And so I'm going to turn to Sir Michael and then to Charlotte, because it's a very strong statement. And so, Michael, I know that you and your team are also working on the commercial determinants of health. And what approaches and messages would you bring to this in your experiences with that? And have you found a way to bring some commercial actors into the conversation?
We have. I don't disagree with anything you said. On the other hand, there's not a disagreement. Most employed people work in the private sector. So to say, and work is very important. So, and their economic activities. So to say, look, they're ghastly people, we're not going to deal with them. That's where most of the economic activity is happening, where most of the work is happening, most of the negative effects on the environment and the society are happening. So it's a very difficult one. I was approached by Legal & General, a huge financial services corporation, insurance. They have, wait for this, 1.3 trillion pounds under investment. I just can't get my head around 1.3 trillion pounds that one corporation controls. You know, I bought peaches and the peaches were so expensive. I thought, how can you buy peaches? You know, 1.3 trillion pounds. And they said, we want to know what we do in our day job, not as philanthropists or corporate social responsibility, what we do in our day job could have a positive impact on health and reduction of health inequalities. So we produced a report, they funded it, not just for them, but for industry. And we said three things: good employment, pay people, everybody, a real living wage, security of employment, you know, no gig economy. You want to be a good employer, the gig economy is out, security of employment, so on. L&G said, that's a no-brainer. Yes, that's good for us. We get loyal employees, that different for other sectors, I know, that thrive on the gig economy. But so good employment. The second, more challenging, goods and services. Now, if it's the tobacco industry, forget it. We have no basis for discussion with you. If it's the food industry, that's more complicated. We'd like, you know, we all have processed food. We'd like you to produce healthy food, not unhealthy food, but that's really complicated. But I said to L&G, how do you deal with that? They said, we are the biggest single investor in the FT listed companies. We should add H to ESG. So environment, social, and governance. Let's look at the health consequences and tailor our investments accordingly. We already don't invest in tobacco, but maybe we should look at other parts of our investment. And the third was a bit like we've been saying to healthcare institutions, be anchor institutions, look at the wider impact on the community, on the environment, who you employ, do you pay tax fairly? So in other words, we're inviting them to be good citizens. Will that make any difference? Well, maybe, for example, with Legal & General, we did a project we called Hidden Workers. So why is this room clean? Because there's an army of cleaners that come in the morning or at night. Mostly they're poorly paid. They have no security of employment. They may be illegal immigrants. It's appalling work and appalling conditions. The MCONet pointed out about employment conditions. So we worked with a couple of companies that paid their employees a real living wage, these cleaning companies, and gave them security of employment. They're more expensive. So when they bid for services, they have to explain why they're more expensive. And it comes to a question I know you have. I'll say it sotto voce because they may not like me to repeat it. They would like legislation. They would like legislation because then they don't have to undercut each other. So if there were legislation saying you've got to pay people a real living wage and you've got to give them proper conditions of employment, they wouldn't worry about being undercut by the opposition. So they would actually appreciate legislation. It's a good step forward for them.
Excellent. Thank you very much. And I think there's a couple of very important points that we've just touched on that you've just brought to us. The first one is the power of financial flows and the importance of financial flows as a determinant of not only harmful industries, but also health promoting behavior, corporate behaviors. And this is definitely an area that I think we as a public health community need to be thinking about a lot more. And this second with regards to that is what we all know, that regulation and legislation matters. And this is again, we come back, we repeat, but it's fundamental in terms of real effective public health change. And I want to move to you, Charlotte, because at the local level, this political economy, the tension points between we know that health and the economy, and there is no economy without health, there's no health without the economy. COVID showed us that in a very, very black and white way. But at the local level, this tension point between commercial actors as community members versus community harmers, and from a health perspective, what do you have to tell us about your experience?
I think this is actually the place where we can win the war. I mean, we cannot win the war nationally. I don't know if you heard the French public health had planned a campaign against alcohol for the World Cup of Rugby, and the government stopped it because, alcohol is good for commerce and everything, and we have a real problem with alcohol in France. I cannot do anything to that. I cannot do anything to improve WHO budget, which is now inferior to just the advertisement budget of Coca-Cola. So we give less money, we use less money to promote national, international public health, from Ebola to commercial determinant of health, from NCD to transmittable disease, than advertising on Coca-Cola. But when I was mayor, I could say, oh, we have a fan zone. It was the Women World Cup of football. There were a fan zone, and to give the authorization to put a fan zone, I said, no, you're not going to give Coca-Cola to the kids. I forbid it. I could do it. I cannot do anything nationally, but I could do it locally. I could say, when I receive people in the city hall, we have the National Public Health School, so we have lots of things. I'm not giving alcohol. I'm not drinking, but I'm not drinking with public money. I've got to walk the talk. And at the beginning, people in my city, on my city council, they were so, oh my God, Charlotte, you're so not funny. Well, I was not elected to be funny. That was not on the job position. But, public health, we're not funny. We're not sexy. We're not good at communication. We're not trending on social media today. Please tweet people. We need to be trending, because this is how we can face and win the war. But at local level, we can do things, and we can push laws, and we can push legislation. And we've been really active on the health nutrition score, Nutri-Score in France, which is now in the EU. How do we have this battle? And actually, the food industry had to change because people wanted better food. So we need better campaigns, we need better data. Look what Finland is doing on data. This Timo Stahl, reach out to him, say it's me, it's amazing. We need to all do that because they're shaping the data so local policymaker can make good decision. So it's easy to read, it's easy to understand, and it's easy to act upon and design better the evidence. Like we've been working in Marseille as an advisor, and they choose to have one priority, which is the obesity of the kids in the most deprived neighborhood. And Marseille has very deprived neighborhood. So the goal is not to fight junk food, is not fight cars, because it's really complex to have moved to bicycle in Marseille. It's child obesity. Nobody can say, oh, I'm against that. I want child obesity. It doesn't work. But through child obesity, through very well-designed workshop with flashcards and very sexy stuff, very tweetable stuff, we convinced all the city council to go, education minister and urban planner and sport people, and everybody is going to act together at city level. And yes, they will eventually stop the advertisement, because you cannot tell the kids not to eat junk food where everything in the poor neighborhood, as a study showed in Liverpool not long ago, everything is about chocolate and alcohol and all that. So yes, because we have a priority for health, because we have all the people around the table, then it's evidence. Oh yes, we cannot smoke on the plane. This is not possible. But before that, before having the health priority and the kids in the middle and the people at the center, no one wanted to address the advertisement. Once you put the health priority, once you gather the good people, it's obvious. Then the evidence is, oh, okay, of course we have to do that. So at local level, we can change. And once we have 100,000, 2,000, 10,000, 100,000 cities that do that, then we change legislation and we have to talk together. So thank you for inviting local leaders.
Thank you, Charlotte. Right, we're down to the last 5 minutes of the session, so I'm going to set us a little challenge. And forgive me, this wasn't in the session planning, but as I look at our Slido, which we asked the audience on a scale of 1 to 10, how determined are we? At the moment, we're scoring mostly 7, which I don't think is determined enough. So my challenge, the 3% of you are 10 out of 10 determined. I actually want to see a show of hands for you, because I'd like to keep you. So whoever you are. But so our challenge to my panel is this, starting with Florence, Charlotte, and then back down, closing with Michael. Bearing in mind that we want to see that figure go up. So I'd like to see our 10 go up from 3%. So our challenge is to leave the audience more determined than we're seeing them at the moment now. What are your messages for the public health, civil society, partners, organizations, colleagues that we have in the room? What are our takeaways? So Florence, starting from me, I'm taking a little bit of liberty because we started late, so we have 5 minutes.
I'll be very quick. I think it's a wrong question, completely wrong question. I think the question should be, how political are we? Are we political enough? Basically, I agree with everything you said. It's about the local, it's about decent, equal employment, but the commercial, social determinants are about politics. It's about the economy. And we need to join the climate change people who are challenging the GDP criteria.
So when you ask yourself, are we political enough? Are we political enough?
No.
Okay.
We are not. We are not. We need to be political. We need to challenge degrowth. We need to challenge the economy. We need to join the well-being movement. And the public health community is not yet political enough. That's the issue. That's a problem.
Thank you so much. Now, I'm going to sort of change the rules of the game. So how can the European institutions, public servants, WHO, how can WHO help, and others help you become political enough? As well as, what are your messages for the civil society group?
Well, I've got one message in: run for office, run for mayor, imagine, run for member of parliament, just take the power, stop being in university, just go there. And we are lots of people willing to train you and transmit what we learn, but just run, take the power.
Thank you very much, Charlotte. 15 years since your report changed everything. What are your 3 messages for us as we close the session.
Number one, which unfortunate that I have to repeat it, is tell the truth based on evidence. And you say political. Every politician I know lies through his teeth. I'm sure the females are more honest, but tell the truth and build the evidence base. And I hear people all the time say evidence doesn't change anything. You know, well, I personally am not going to get down into the swamp. I'm not going to play that dirty game. I know what it is I do, and I don't disagree with what you've said at all about the importance of the political, but let's retain our values about everything we do should be based on the evidence and tell the truth. Number two, again, unfortunate that it has to be repeated. I was at a meeting in London last week, one of the political parties, and the former Secretary of the Cabinet, so the Chief Civil Servant, whose initials are Gus O'Donnell, G-O-D, introduced as God. I think that was his role when he was head of the civil service. And God said, I agree with everything Michael said, because I'd spoken before him, but we have to, it's not just about health. And I thought, he hasn't understood it at all. I'm talking about the social determinants of health. And too many people think once you mention health, you're talking about the healthcare system, and that's what you're talking about. And oh yeah, we're interested in health. That's why the Minister of Health is trying to get access to. Unfortunately, a major challenge is to keep social determinants of health on the agenda. And the third is let's keep sight of why we're doing this and the twin challenge of climate and inequality. There was actually, from an unlikely source, comment 26 published on the Convention of the Rights of the Child. Brilliant paper that was published, I think, last week or 2 weeks ago. And it talked about the triple challenge, environmental challenge, of the climate crisis, of the lack of loss of biodiversity and pollution on the one hand, and inequality on the other. That's why we're doing what we're doing. That should be central to everything we do. Let's continue that focus.
Fantastic. Thank you so much. So Michael, and on those words, get political, the message that we've heard, get organized, retain your values, keep social determinants high on the agenda, and let's not forget that all of these are the outcomes of the same problems. These are different faces of the same challenges. So please join me in thanking our fantastic panel.